prednisone is a steroid. Does that mean if you take it, you're going to be a bodybuilder? Not necessarily. Let's talk today about how prednisone side effects affect men. I'm Dr. Megan, your prednisone pharmacist, and here is showing that prednisone is a steroid. What? What are you talking about? It's not testosterone, but it is related to testosterone. You see prednisone there on the left, and over on the right, you can see some different hormones that are in our body, including steroid hormones. So you see, prednisone is mimicking cortisol on the top, our wear and tear hormone that affects our ability to deal with stress. And then on the bottom there are the sex hormones. That means the female hormones, progesterone and estrogen, and the male hormone, testosterone. Because they all look pretty similar, they all have this 4 circles that kind of match each other, our bodies can get confused, and taking prednisone can interfere with the normal rhythm of these hormones, and the cascade can be messed up. So understanding that will explain what I'm about to show you on the next slides about how prednisone affects men differently than women. So because prednisone looks like those female hormones, some men report changes in their physical anatomy. So this is very rare. Don't think, oh no, my doctor prescribed prednisone, I'm going to get boobs. No, this is very, very rare. It's possible that a man could have changes in his breasts. They might become tender. They might get a little bit bigger. Often prednisone causes weight gain, and that might happen in the breast area too. Other men report that their penis is smaller than it usually is. What's great is that usually these things go back to normal when you stop taking prednisone. All right, the male hormones. Because prednisone looks like testosterone, it can change things like your voice. So you might get a little huskier voice than usual. It might give you a higher voice than usual. It's just unpredictable and rare, but it's possible. Finally, the sperm. So either the sperm can have dysmotility, which means they can't swim as well. They're just not built to swim quite as well as they're used to. Or the sperm might have a lower count. So it's possible to have a little bit of less fertility while on prednisone, because essentially there's not the right balance of hormones of the estrogen and the progesterone and the testosterone in the body to create the most fertile environment. So even in men, hot flashes are possible. You think, I'm a man, there's no way I'm going to feel like I'm in menopause. But it's true. The prednisone can make you feel like you're a menopausal woman. And you can get hot flashes with the sweating, the redness, the flushing, and even the mood changes. Speaking of mood changes, psychiatric side effects of prednisone are different in men and women. So men can have, luckily for you, usually have less psychiatric side effects than women. But when men get psychiatric side effects, they're more likely to have mania and feel totally unlike themselves and kind of crazy. Delirium, to just be incoherent and babbling and not with it at all. Just not be your normal self. That is more typical in men than in women. And all of those changes are more likely when you're on a higher dose. So don't worry, it's not you, it's the medicine. It's a side effect. So don't feel like, oh no, I am going crazy, because no, this medicine is making you feel crazy and you do need to get legitimate treatment for it, but it's not you. So don't feel like you have a personal failing in any way. Give yourself grace, get the help you need, and it will go away most of the time when you stop taking prednisone. Okay, now what about hair? So hair loss is more common in women than men, but it is possible. And then a change in facial hair can happen in men as well. Women notice that they start getting facial hair that they never had before. So it's possible because of those strange hormonal changes that men can also have facial hair changes. And one of the most important things is preventing bone loss. So prednisone is the number one drug that causes osteoporosis, and anyone who's taking doses over 7.5 milligrams a day should be taking vitamin D and calcium according to the doctors who prescribe prednisone the most. And men have less osteoporosis than women, than postmenopausal women, but it's still likely. And then avascular necrosis can happen to anyone, young or old, male or female. So if you're ever having hip pain that wasn't there before, make sure you talk to your doctor about it. And so what can you do about all of this? I've got tips for you on the wellness checklist. If you, below you can see your options for how to get access to this. And signing off as Dr. Megan, your prednisone pharmacist.